Now we will talk about the neonatal pain assessment, reassessment, and management, and the vaccination. The assessment of pain, it is including physiological and behavioral cause. The physiological cause, it is including change in the heart rate, respiratory rate, oxygen saturation, and the blood pressure. Behavioral pain, it is including altered facial expression, change in the activity level, agitation, and the crying. The most neonates will have their pain well managed with morphine and paracetamol and clonidine. We have two methods of the pain management. One, pharmacological method of pain. It is used to management and the treatment the pain in the neonatal for the neonate was admitted in NICU by analgesic drug such as paracetamol, fentanyl, morphine, and midazolam. Another method, non-pharmacological method, it is used to management and the treatment the pain for the neonate was admitted in NICU by positioning, bright need reduction, noise reduction, minimal handling, breastfeeding, skin-to-skin contact, and non-nutritive sucking. When should pain be assessed and reassessed? The pain should be reassessed after each intervention to evaluate the effect and determine whether modification is needed. We have the gold standard of pain assessment. What is the gold standard of pain assessment? Numerical rating scale, the range from 0 to 10. 0, it means no pain. 10, the maximum pain. This is the neonatal infant pain scale. It is used for the full term and preterm baby less than 1 year. The characterized is facial expression, crying, breathing pattern, any activity for the arm and leg, state arousal. From 0 to 2 point, it is mean no pain. 3 to 4 points, it is moderate pain. More than 4, it is the severe pain. Another scale, it is crisis scale. It is used for the neonatal. It is used for the neonate from 0 to 6 months. The characteristics include crying, require of oxygen, including heart rate, and require of oxygen, increased vital signs, including heart rate and blood pressure, expression, and sleeplessness. Vaccination. The neonates have immature immune system, which highly suspected of the infection. What is the first vaccine baby will receive? The hepatitis B, it is the first vaccine baby will receive. It is given within the 24 hours of birth. And the second dose of hepatitis B, it is given within 1 to 2 months old. And the third dose, it is given from within 6 to 18 months. Which vaccine is important for the baby starting at 1 to 2 months age? Hepatitis B second dose, diphtheria, tetanus, and whooping cough, Haemophilus influenza type B, polio, and pneumococcal vaccine, and rotavirus vaccine. Today we will talk about the mechanical ventilation. The equipment needed for the intubation, laryngoscope, suitable size of the blade. We have three sizes of the blade. Blade 00, it is used for the extreme preterm baby. Blade 0, it is used for the preterm baby. Blade 1 for the term baby. Should be tight and light was working. Then ETT suitable size, each size we should keep it to. CO2 detector, meter, OGT suitable size, syringe, meconium aspirator, laryngeal mask. Then what is the indication of the intubation in the neonate? The most common indication of the intubation in the neonate, it is chest retraction, respiratory distress, diaphragmatic hernia, respiratory acidosis, apnea, surfactant administration, and if patient having MRI or OR, they should intubate the baby. We have 5 type of retraction: suprasternum retraction, substernum, supraclavicular, subcostal, and the intercostal. How we will give calfactant and surfactant? Calfactant and surfactant we are giving through the ETT, and the calculation should be according to the baby weight. The surfactant 4 ml per kg, calfactant 3 ml per kg only. Deteriorated, hemoglobin was low, Blood was going, X-ray done, showing mild RBS. Doctor advised elective intubation and
oxygen consumption. First, we will check and connect the amplifier. After check the oxygen supply and suction, we will connect. Before, I will check the flow, 10 liters per minute. Then suction for a B-tail from 60 to 80 liters. Full tail 80 to
100. From the tip of the nose to the air triggers, this one. From the tip of the lips to the end of the connector. It was 9 plus 10, 19, plus 0.5, 19.5. The medication, expiry and color. Now we will talk about the postoperative nursing care and wound care. The postoperative care is the management of the client health during postoperative period, managing the pain, supporting oxygenation and cardiovascular stability, management fluid balance by connecting IV fluid, providing wound care, monitor bowel function, assisting mobility, prevention of any complication. The most early postoperative fever, it is caused by the inflammatory stimulate of the tissue damaged and exposure to the foreign material. What is the complication after surgery? Fever, shock, hemorrhage, wound function, DVT and pulmonary embolism, lung complication, urinary retention, reaction to anesthesia. Now wound care. We have 5 rules for wound care. 1. Assessment of the wound, cleaning the wound, regular dressing change, selection of the appropriate wound dressing, use the antibiotic. We have critical point for wound care. For the old dressing, we are checking by the color, odor, consistency, and amount. For the wound, by the time, tissue, infection, moisture, and the age. Should be remove the old dressing by the cleaning gloves, then clean new one by sterile gloves to establish sterile field, and how to clean the wound from the inner to outer. This is the way of the cleaning the wound.
Wound care dressing change with irrigation and packing. Before beginning this procedure, always perform the following steps to ensure patient safety. Perform hand hygiene. Provide patient privacy. Introduce yourself. Use 2 patient identifiers. Verify allergy status. Perform environmental safety check. Ensure proper body mechanics. Gather all supplies. Provide patient education. Assess the patient's condition, including the dressing and wound, as well as the pain level. If needed, medicate with analgesic 30 minutes before procedure if medication is to be given PO or IV. Explain the procedure to patient. Materials needed for dressing change: gloves, biohazard bag, irrigation tray with bulb syringe, normal saline irrigation bottle, dressing change tray, measuring device, sterile cotton swabs, 4x4 gauze pads, tape, sterile gauze pack, sterile gloves. The procedure. Position patient. Apply clean gloves. Remove the old dressing, including packing, and assess the old dressing, noting color, odor, consistency, and amount of drainage. COCA. Dispose of old dressing in biohazard bag. Assess the wound edges and wound bed. Note any presence of infection. Checking for healthy granulated tissue, exudates, slough, eschar, indurations, swelling, etc. Measure length, width, and depth using wound measuring tools and a sterile cotton swab. Dispose of soiled supplies in biohazard bag. Set up irrigation supplies. Irrigate wound using gauze pads to catch solution and debris. Remember to irrigate in one direction until solution runs clear. Pat wound bed with sterile gauze pads as needed. Discard gauze pads in biohazard bag. Wash hands per CDC guidelines. Prepare sterile dressing change tray and dressing supplies using sterile technique. Do not cross or turn once back to the sterile field throughout the procedure. Don sterile gloves, maintaining sterile technique throughout the procedure. Repack wound with sterile packing using sterile technique. Be careful not to touch the edges with the sterile gauze. Remember not to cross the sterile field when disposing items in the appropriate receptacle. Apply sterile top dressing. Secure dressing appropriately. Label dressing with date, time, and initials. Ensure safe environment. Return bed to lowest height with brakes locked and appropriate side rails up and call light and bell in reach. Dispose of soiled supplies in biohazard bag. Wash hands per CDC guidelines.
We will talk about point of care testing blood glucose. Point of care testing for glucose at the bedside or in the home or hospital. It is used to monitor patients with diabetes. When should glucose control tests be run? You need to check your blood sugar several times a day, before meals or exercise, at the bedtime, before driving, and when you think your blood sugar level are low. If your results showing higher than normal glucose level, it may means you have risk for getting diabetic. The high glucose level, it is sign of hyperthyroidism, pancreas disorders, stress from the surgery, very serious illness or trauma. How often should point of care testing glucose monitor be tested with control? The blood glucose testing, should be every 24 hours.
Point of care testing, whole blood glucose test. After ensuring the quality assured meter, let's do the testing. First, check doctor's order or unit protocol. Prepare needed materials such as glucometer, test strips, lancet, needle, alcohol pad, small adhesive bandage and dry cotton. Check for integrity and expiration date as indicated. Perform hand hygiene and wear appropriate PPEs. Then, confirm patient's identification. Explain the procedure and provide privacy. Turn meter on, log in by scanning own employee designated barcode. Scan strip lot number and click accept button. Scan patient's identification barcode and press accept. Now, insert strip in meter. The meter is ready for use. Select appropriate puncture site. Fingertip side for adult or children patients preferably, in rotational manner. Use alcohol pad to clean the area, dry thoroughly. Puncture the site as you assure the patient. Wipe the first drop then squeeze the finger again to form a second drop of blood. Then, apply screen displays. When the blood drop appears, touch the end of the test strip to the blood drop until the well of the test strip is full and the meter beeps. After 6 seconds, the result will be shown and press accept button. Apply gentle pressure on the puncture site using dry cotton and cover with small adhesive bandage. Observe for further bleeding. Discard used items such as the test strip and needle in the sharp box. Remove PPEs and perform hand hygiene after. Do not forget to document blood glucose results in the patient's file and give due medications as ordered. Appropriate actions should be given for abnormal findings.
Today we will talk about the physical restraint and monitoring. The physical restraint means it is used for the manual hold to restrict freedom of movement for all or the part of the person body, or to restrict normal access to the person body, and that is used as behavioral restraint. What should monitor when patient is under restraint? Monitor the psychological status, risk for injury, and readiness of the restraint discontinuation. There is 4-point restraint, with their restraints both arm or the both leg. How long can patient be in restraint? For the adult more than 18 years, it is 4 hours, 2 hours for children and adolescents from 9 to 17 years old, 1 hour for children less than 9 years. Nursing intervention for restrained patient. Monitor vital signs including heart rate, temperature, blood pressure, and respiratory rate. Assess patient status every 15 minutes in the first 1 hour. then every 30 minutes. Room exercise and toileting every 2 hours. Immediately remove restraints when the patient no longer danger for themselves or the other.
So in this lesson, we want to talk about restraints. Specifically, we want to show you the technique for applying soft wrist restraints. Now, if you want to learn more about restraints, there's a great lesson in the fundamentals course. But the most important thing you need to know is you need a valid reason for the restraints and a valid provider order. So if you have a patient who has a need for restraints, you've got a provider order, and you've explained to the patient and family what's happening, you can apply the soft wrist restraints. They usually come in a pack of 2. So the first thing that you want to do is apply the cuff around the patient's wrist and secure it. Sometimes this is Velcro, sometimes there's a buckle, sometimes both. You want to make sure that you can still fit 2 fingers snugly under the cuff. The last thing we want to do is cause any issues with perfusion because we tied the cuff too tight. Now, before you attach the strap, make sure you locate a non-movable part of the bed, so not the side rail. You could cause injury to the patient if you put the side rail down with the strap attached to it. So once you've located your spot, you're going to take the strap and wrap it around the frame, and then you want to pull a loop through, and that's going to help create a slip knot. Now, I personally like to create a double slip knot. So once I've pulled my first loop, I'll actually go back and I'll pull a second loop through. And what you'll see is that not only is it actually secure, so the patient isn't able to get out of it, but it's also a quick release knot. So you can easily grab the strap and pull it if you need to care for your patient, like you need to turn them or sit them up. Keeps it safer for the patient.
Hello, how are you? Today we will talk about blood and blood product administration. First of all, what is the purpose of the blood and the blood products? It is to provide blood or blood product in the safe and timely manner, and to minimize the risk of complication. We have many types for blood and the blood product for transfusion. One of them, whole blood, red blood cells, platelet, and FFP. For starting the blood transfusion, we have to assess and preparation the patient. First of all, assess the patient for existing back or flank pain or hematuria. Assess patient for any history of previous blood transfusion and the transfusion reaction. If any transfusion reaction, if there is any previous transfusion reaction, we will inform doctor regarding this one. Ensure the blood and the blood product consent has been obtained. Verify with doctor the type of component and the amount and the special procedure time of administration and the rate. Ensure the patient has been intravenous access or central line for the transfusion. Then the vital signs monitor the frequency of the vital signs 1 hour pre-transfusion. Then after starting, we will check every 15 minutes, then 30 minutes, then hourly. After ending the transfusion, we will check also 1 hour post-transfusion. The maximum time for transfusion, 4 hours. Don't give more than 4 hours. Okay, then the management of in the case of the blood transfusion reaction. If any transfusion reaction for the patient, first we will stop the transfusion immediately, remove the blood component from the tube and replace with normal saline in the new tube. Obtain the vital signs, inform the doctor, inform the blood bank for the reaction, and there is one form we will fill. And there is some investigation. We will follow the protocol of the transfusion investigation. Report the reaction form completely and enter to the system. Document all the information surrounding the transfusion reaction. Before starting all the procedure, we will do hand hygiene and we will wear the PPE. This is the video for hand hygiene. Then PPE you will see.
Now we want to show you the proper technique to don and doff sterile gloves. So we're going to open our package, slide our gloves out, make sure we have the left on the left, right on the right. Be careful when opening the package. We don't let our fingers accidentally touch the area where the gloves are exposed. We'll have to start over. So it's very important at this point as you're folding back that paper to ensure that it doesn't flip back over onto the sterile glove. If that's the case, then you've contacted non-sterile with sterile areas and you're going to have to restart the process. So the inner area of the cuff is considered non-sterile, so we can touch that. Anywhere that's on the outer part of the glove is considered sterile. So we're going to slide in, making sure our fingers and thumb get aligned properly. Pull that on. Then we're going to use our sterile glove to slide inside of the opposite hand glove. Now, as we're doing this part of the donning, we want to make sure that we do not let our sterile thumb come in contact with the non-sterile surface of our other glove. So here we have successfully donned our sterile gloves. Now it's time to remove them. The easiest method to remove your gloves is to pinch one glove in the palm, to gently pull it off, and to roll it into the palm of the other glove. At this point, you want to slide your fingers inside the cuff, doing your best to not contact that glove and contaminate your fingers. And you're going to pull it inside out so you've contained both gloves inside.
First, I will check my doctor order. Then our consent to be done, and I will check blood with blood bank for blood type and all patient information, MRN and this for name for baby. Then what is RH and expiry date and the product, everything we will check. Will independent will check with my friend. And she will check alone. For name and medical number. Then I will assess my patient and I will check all vital signs before the give blood transfusion. This cannula, then I will check the potency of cannula and we will flush before a blood transfusion.
Prepared my equipment under aseptic technique. I will brine the IV set with normal saline. clean 3 times. I'll connect the port and hang and prime the IV tube.
blood. We will close observation about vital signs. First hour, every 15 minutes, then every 30 minutes, second hour, then hourly up to we will finish the blood transfusion.
Now we will talk about medication administration. We have many types of the medication. One of them, LASA medication. The LASA medication, it is means LA, it is looks alike. This is the medication in the similar name or packaging that's confusing and lead to error. For example, this is this medication and dextrose with the D50 and bicarb. This is the LA medication. Sound alike. This is the drug names which, due to their pronunciation, may sound similar to other drugs. For example, dopamine and dobutamine, it is the same sound. Okay. We have 9 rights of the medication administration. B, it is the right patient. D3, right dose, right date, and right documentation. R, right route. T, right time, right label, right expiry, right education, and the last one, right refuse.
After that, I will check my baby, introduce myself for parent, then I will explain to parent what I will do for baby. Then I will check for name and an MRN for 2 ID band. After that, I will prepare my equipment. Under sterile technique, hygiene, before I prepare my equipment. Then I will wait my hand until dry. Clean gloves for prepare my equipment. First, I will check the proper size for my cannula. After that, chlorohydrate for clean. assist for site for cannula and choose one vein under criteria. I will check, then I will choose this one.
medication. First of all, I have to verify the doctor order and acknowledge in the system. Second, I will go to the patient and introduce myself to the patient. Third, I will identify the patient by the 2 correct ID band and 4 names and MRN, and explain what I will give to the patient medication, and I will talk to the baby. Sorry baby, I will give you medication to make you better. Now I gather my equipment and I prepare my medication to give to the baby. Now after I prepare my equipment, I will independent double check my medication for the patient with another nurse and in the neofax. And follow the line right of the medication, which is right patient, right route, right time, right label, right expiry and education, right to refuse, right drug, and right documentation. Patient, and again I will check the ID by 4 names and MRN. I prepare equipment. This is the sterile normal saline for flushing. My needle. This is needle filter after using ampule to remove the small particles. Alcohol swab and gauze. Filter needle to remove the small particles. And again, I will identify my patient by 4 names with 2 ID bands and MRN. I will start giving my medication. First, I will clean. By wiping the board 3 times by alcohol swab. I will use sterile normal saline for flushing. I will flush my vein to check with non-touch technique. After that, I will wipe again 3 times by alcohol. Then I will give my medication as ordered by doctor with slowly push as ordered. Give medication, I have to assess patient for any reaction and take the vital signs and document the medication.